In this video lecture, we'll review the prevalence and course of obsessions and compulsions, as well as disorders included on the obsessive-compulsive spectrum. We'll start by discussing evidence of the prevalence of obsessions and compulsions in the general population. The findings in this study show that obsessions and compulsions are not limited to individuals with OC spectrum disorders. In fact, it is more common for individuals to report experiencing obsessions, compulsions, or both than not to report experiencing either of these. In this data, nearly 1/3 of participants reported experiencing obsessive thoughts, more than 1 in 10 individuals reported experiencing compulsive behaviors, and over 40% of individuals reported that they experience both intrusive or obsessive thoughts and compulsive behaviors. Moreover, it is not possible to distinguish the content of obsessive thoughts or compulsive behaviors between clinical and non-clinical samples. In the same study, the researchers identified multiple examples of obsessive and intrusive thoughts and potential compulsive behaviors that could not be distinguished by experts as belonging to individuals experiencing a clinically significant disorder compared to individuals in the general population. Take a moment and look at the examples below and see if you can guess which of these examples were reported by an individual with an OC spectrum diagnosis compared to an individual with no such diagnosis. The two examples below that were reported by individuals with a diagnosis of an obsessive-compulsive spectrum disorder included experiencing the impulse to jump onto the train tracks when a train was approaching and having intrusive thoughts of accidents happening to loved ones. In this study, the examples of experiencing the impulse to jump out of a window and experiencing intrusive thoughts that the individual might push someone off of a bus or a train were both reported by individuals who did not have an OC spectrum diagnosis. All of these are common intrusive thoughts and impulses to commit specific behaviors. Obsessions and compulsions are both very common in the general population, but OC spectrum disorders are much less common. This is another set of disorders where reliable epidemiological evidence is hard to come by. In general, evidence suggests that somewhere between 1 and 3% of the population meets criteria for most OC spectrum disorders, either at a given point in time or during their lifetime. In the National Comorbidity Survey replication, 1.2% of participants had met criteria for obsessive-compulsive disorder within the previous 12 months, and 2.3% had met criteria for OCD within their lifetime. The point prevalence for body dysmorphic disorder appears to be between 2 and 3%. The prevalence for hoarding disorder appears to be slightly higher, with estimates ranging between 2 and 6%. However, because this is a new disorder that was added to the DSM-5, we have limited epidemiological studies that include information necessary to diagnose hoarding disorder. Evidence suggests that the prevalence of trichotillomania and excoriation disorder is slightly lower, with estimates for trichotillomania ranging between 0.5% and 2%, and between 1 and 2% for excoriation disorder. There are few systematic demographic risk factors that have been identified for obsessive-compulsive spectrum disorders. Generally, we see that there is a comparable prevalence cross-culturally in terms of different diagnoses, and also in terms of the typical onset and course of these disorders. There are also very interesting similarities across cultures in terms of the major themes that tend to characterize individuals' obsessive thoughts and compulsive behaviors, although these may manifest differently across different cultural contexts. We do see an increased risk for OC spectrum disorders among individuals with tic disorders, such as Tourette's disorder, and there is some evidence that there may be an increased risk for OC spectrum disorders among individuals with a personal or a family history of other neurodevelopmental disorders. So, for example, people are investigating whether there might be increased risk for OC spectrum disorders among individuals with autism spectrum disorders. We do see a significant increase in the prevalence of OC spectrum disorders among those with a family history of these disorders, and this is particularly true among those whose first-degree relatives have experienced these disorders with onset in childhood or adolescence, as opposed to onset later in adulthood. And finally, there is evidence that women may be at greater risk for trichotillomania and excoriation disorder compared to men. However, there do not appear to be gender differences in the prevalence of obsessive-compulsive disorder, body dysmorphic disorder, or hoarding disorder, although the ways in which those disorders manifest may differ between women and men. For example, in body dysmorphic disorder, women and men often express concern related to different specific parts of the body. The course of the disorder often has a gradual onset. We do see gender differences in terms of the typical time of onset of these disorders, particularly OCD. Childhood and adolescent onset is more common among men and boys, while women are more likely to have the onset of OCD in early adulthood. Across all of these disorders, and for both men and women, OC spectrum disorders tend to have a chronic course with waxing and waning symptoms that will often be exacerbated in the context of stress. But without treatment, these disorders tend to be chronic, and individuals will tend to experience recurrences of symptoms throughout their lifetime.